It is well documented that individuals with disabilities find strength and opportunity from participating in community. Now see how the adrenaline and power of community are working to strengthen providers across America. As our nation's premier trade association for organizations serving individuals with disabilities, ANCOR is America's community of community providers. 800 strong and growing more influential by the day, ANCOR advances the cause of community by keeping its finger on the pulse of government, by innovating the unthinkable, and by equipping every member to negotiate the increasingly complex terrain that shapes our human service landscape.
Our members provide a broad spectrum of supports and services to people with various disabilities. Across a broad spectrum of services, which include everything from residential services to transportation, respite, day services, employment services.
While ANCOR members are immersed in managing the day-to-day operations that affect people's lives, ANCOR is busy charting a path to a respected future based on common needs and collective aspirations.
It provides us the roadmap to connect to the issues that are most important to us at a federal level.
We learn best practices. We learn what's happening on the regulatory front. It helps us to go home and be better armed and better providers.
We have been able to avoid lawsuits and put money into services for people. I mean, that's just one example of what ANCOR has done.
They keep us abreast of what is the latest and the greatest going on in the field. Sometimes that's invaluable to know that something new has happened over in California, and why can't we try something like that here?
We don't have the time or the resources to focus nationally, and so to know that there's an organization like ANCOR that we can rely on, I value and really highly trust the information that comes out of ANCOR.
There isn't a provider this side of Bangor that isn't plagued by rampant turnover. That's because for generations, America's unsung heroes have shouldered the most daunting aspects of human service without ever receiving the respect or remuneration they deserve. Now, thanks to ANCOR's groundbreaking national advocacy campaign, real change is on the horizon. Legislation to establish a living wage has been sponsored. Rallies have been staged. And congressional as well as public awareness have reached new heights regarding the urgent need to dignify direct support as a skilled support profession.
Our national advocacy campaign was launched in 2001 on behalf of the frontline workers who actually do the face-to-face supports and services for people with disabilities.
We are publicly funded. We rely upon the state and federal funding to support individuals with intellectual disabilities. The more that funding includes a living wage, the more we'll have a stable workforce, that will continue to provide quality of care and some stability with the individuals that they support.
ANCOR has been in the forefront of introducing policy and legislation that recognizes the value and the importance of the work that we're doing, because we are supporting some of the most underserved people in the country.
Through the National Advocacy Campaign, we really have built partnerships with other agencies, have really started to make a strong voice with our senators and our representatives about what our workforce needs.
They provide an overall umbrella for us in terms of coordinating our advocacy efforts to make sure that we're speaking from one page, sending a clear and concise message to our members in the Hill.
We could not push for a living wage and better support for direct service providers without ANCOR taking the lead on it.
With shrinking resources and increasing competition, those that serve individuals with disabilities are finding their community-based methods scrutinized as never before. Thankfully, ANCOR had the foresight to develop a performance excellence initiative to support each member's quest for quality while anticipating increased federal and state demand for evidence-based outcomes.
ANCOR is leading the way in developing some indicators that we can all measure ourselves against in very important areas.
The Center for Medicare and Medicaid Services is increasingly interested in defining key metrics for how providers are performing. We define quality as a journey toward excellence. It's continually evolving. We are continually learning how to best meet the individuals with disabilities' hopes, dreams, and aspirations.
If we don't benchmark our own performance and measure ourselves against that performance, then someone else is going to develop benchmarks for us, and we may not like that.
By generating the kinds of measures that can compare performance and outcomes across agencies from a systems perspective, ANCOR has helped to establish the kind of quality benchmarks that are working to enhance and safeguard supports for individuals with disabilities for generations to come.
We decided if we were going to do a national quality performance excellence initiative, we should do it beyond just the disability field and really go to the experts. So we modeled our program after the Malcolm Baldrige quality program, which is a national quality program.
And it's always a good idea to put forward your own standards rather than have those set for you by a federal or a state agency. And if we're already participating with it, as providers, it will only become much more appealing to a state and to a federal agency to not have to recreate the wheel.
So how does this help our members? It helps them because it gives them validated national data against which they can measure their agency's performance across various factors of quality. And they can see whether they need to improve, whether they're at the benchmark already, or whether they're below the benchmark.
Through this project, we can create policy that makes sense, that's responsive to the consumers and to the families, that meets the real-life challenges and opportunities that providers face on a daily basis.
The way it benefits us the most is because it enables us to improve the quality of the service we offer to the people. And for us, that's the bottom line.
With a mission that routinely demands providers to accomplish more with less, ANCOR members are hungry for every opportunity to save.